As we all know, a provincial election has been called earlier today. And for those who may be wondering, I would like to assure you that the BC COVID-19 response will continue uninterrupted. And it is, of course, my priority. As has been done since the start of this pandemic, a daily COVID-19 update will be provided Monday to Friday to keep everyone in BC informed. I will also be continuing with the in-person briefings on Mondays and Thursdays, as we have been doing for the past number of weeks. As well, the Deputy Minister of Health, Stephen Brown, and myself will be meeting with Minister Dix and with the Caretaker Minister, Minister James, to make sure that everybody is up to date on what is happening on a daily basis with the pandemic and is able to ensure that we have active ongoing management of any issues that arise as we move through this pandemic together. Having said that, I do also want to take a step back and just to acknowledge with gratitude that I am speaking to you today from the traditional territories of the Lekwungen-speaking peoples of the Esquimalt and the Songhees First Nations, and I'm very grateful to be here today. So like other parts of our economy, I have also worked with Elections BC to make sure that we had guidelines in place for a safe election process. And that is something that we have been talked about before, that we've been working with Elections BC since in March, when there was elections planned. Municipal elections had been planned for later that month, and we have been working with them continuously since that time, recognizing that there was potential for elections as this pandemic progressed, both municipal, provincial, and federal. And the guidelines that we've come up with include how political parties and their candidates need to keep themselves, their staff and volunteers, and their communities safe during the campaign. We've also outlined how elections processes need to occur to ensure that everybody in the province remains safe and these can be handled safely. And tomorrow I'll be joining the Chief Electoral Officer and we'll brief everybody on the specific details of the plans. So for today, for our COVID update, we have 3 reporting periods. From Friday to Saturday, we had 121 new cases of COVID-19. Between Saturday and Sunday, 117 new cases. And Sunday to today, 128 new cases were identified. That gives us a total of 366 new cases, including 7 which were epidemiologically linked, bringing our total in British Columbia to 8,208 people with COVID-19. That includes 2,945 in the Vancouver Coastal Health Region, 4,211 in the Fraser Health Region, 203 people in Vancouver Island Health, 508 people in the Interior Health Region, 255 people in Northern Health, and 86 people who were born or who reside outside of Canada. We have 1,987 active cases today across the province, of whom 60 are in hospital, 21 of whom are in critical care or ICU. Over this past weekend, we have 4 additional people who have died from COVID-19, bringing the total number of deaths to 227. There were 2 people in Vancouver Coastal Health, 1 in Fraser Health, and a second person who died in Northern Health Region. And my condolences and my thoughts go out to the communities, to the families, and to the care teams who looked after these people. We have 3,233 people under public health monitoring across British Columbia and 5,972 people who have now recovered. We have 1 additional healthcare outbreak to report today. That's at Yale Townhouse, a long-term care facility in Vancouver Coastal Health, where a single healthcare worker has been identified and outbreak protocols have been implemented. And 1 outbreak has been declared over at the Queen's Park Acute Care Unit. We now have 15 active outbreaks in our healthcare system, 12 in long-term care assisted living and 3 in acute care, involving 813 people so far. 484 residents and 329 staff. We have no new community outbreaks, but I do encourage people to check with health authority websites regularly as exposure events continue to recur. As you know, we are also posting exposure events that are happening in schools around the province to make sure that everybody is aware and that they know that we are working with schools and public health together to manage any cases that arise. We've had a number of exposures in a number of different school settings. They are mostly very low risk, which is what we would expect. We have had no clusters, no transmission events in schools, and no outbreaks at this point. And we must continue to stress the layers of prevention that we have in place in our school system to make sure that children and teachers and staff can get back to school safely. And on that note, I do want to thank all of the teachers and the staff who have done amazing things in the past week. I have heard many stories over this past weekend about the happiness of children being back in the classroom. It's been challenging, I know, but the innovation and imagination that's been shown has been tremendous. I also want to thank school staff, from our bus drivers, admin staff, custodial staff, who've all done an incredible job over the past week to get children back into the all-important learning environments that they need in schools. COVID-19 requires new routines and new boundaries to keep our friends, our families, our communities safe this fall and winter. It's important for all of us to take a few minutes to determine what are our safe distances for each of our activities. I know it would be helpful for many people to have clear black and white guidance of what to do. And many of you have personally reached out to me for ask for this. But when it comes to making a safe distance, it really is on a spectrum, and it depends on our own situation and our own circumstances. But as a rule of thumb, for people you don't know that you are spending time with, you need a bigger distance for those people you are close to. Think of it this way. At one end of the spectrum is the person you've never met before, and at the other end is your bubble, your immediate household bubble. Everyone else is in between. And a few more specifics. For people you don't know or see regularly, maintaining that 2 meters is incredibly important. And if you're outside, it's less risky than being inside. If you're inside and you can't maintain those 2 meters, that's where it's incredibly important to wear a mask. For your household bubble, getting close with hugs and kisses is absolutely fine. Those are the people that we need to have that physical contact with. For classmates and colleagues who you see most days in a more structured environment, the distance may not need to be as great as long as you keep those interactions in a managed way. So we are always sitting next to the same person. You're always making sure you're part of that same small group. And it's part of your regular group that you're together with in a classroom. And no mixing between multiple groups. For your safe 6 friends, closer is okay, but not physical contact. So no hugging and kissing with those friends. Those are ones where you want to keep that same 6 and you can have more close contact. Of course, if someone you spend time with is older or has an underlying health condition that makes them more at risk to having severe illness from COVID, you might want to step back and reduce the number of contacts you have outside that, or maintain a distance from those people if you are in situations where you have had contact with numbers of others. If your job or other activity requires you to be around a lot of people, then you want to slide up the distance scale and stay farther apart. The easiest way to set these new routines and help protect your communities as we go through this respiratory season is to stick with that same group, small group of friends, the same colleagues, the same classmates. I'd like to thank everybody in our province for your continued resilience and determination to see this pandemic through. It has been a long haul, and we have a ways to go in this storm. I invite you, as we head into fall tomorrow, to set your personal safety plans for the season ahead, to think about how you are going back to work, back to school, back to other activities, and where you need to pull back and maintain more space and more distance. The actions each of us takes today will help ensure that we are going to get through the next few months safely. So let's continue to each of us do our bit each and every day to flatten our curve again. Let's get ready for the respiratory season. Hold steady with our layers of protection. Step back from our socializing with different groups and step forward on these routines that will keep our communities and our loved ones safe. And of course, let's continue to be kind, to be calm, and to be safe. Thank you very much, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to reporters on the phone line, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. Please also take yourselves off mute. You will not be audible until your name is called. First question is from Richard Zisman, Global News.
Dr. Henry, I'm just trying to understand the powers. Do your powers remain the same now that we are in election, and that you will be briefing daily with Carol James and Adrian Dix, and decisions that you make now must be go through those 2 individuals rather than how has that changed now that we have an election?
Yeah, so my powers are actually independent, so they don't depend necessarily on the ministers. Much of the powers under the Public Health Act to take actions, to issue orders, are things that I can do independently. Obviously, it's important for us to do that together and to make sure that everybody is aware of why and what we'll be doing. But we also have a Deputy Minister of Health who takes on much of that responsibility, and so I will, of course, be continuing to meet daily with the Deputy Minister, and most of the decision-making will be done with the Deputy and myself, and he will be, and we will both be in contact with both Minister James and Minister Dix for direction and advice as needed, yes. And we're having a daily update to make sure that everybody is up to speed on what's happening.
Richard, do you have a follow-up?
I do. Was there any advice that you provided to John Horgan around what the spring will look like or the fall of 2021 that you believe helped shape his decision to call an election now?
I can say that Premier Horgan did not ask for my advice around calling an election, and nor would I expect him to. My role is to provide advice on the health of the population and to put in measures that are needed to ensure that activities that need to happen can happen in our community. And that is what I will continue to focus on. So no, I was not asked for advice on timing of an election, and that is part of the political process that I am not part of, and so I would not expect to have been asked.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. There's been a new checklist made for parents to do before sending their kids to school, and it's removed several symptoms that have been there all along. It says students can stay home if they have fever, chills, cough, etc. But if a child has a sore throat, a headache, fatigue, or a runny nose, they should still or could still go to school. Doesn't that go against everything we've been told for the last 6 months about not going to work or school if we're even the slightest bit sick?
Yeah, so what we have learned about a number of different things is that from the data that we have both here in BC but also across Canada and from places around the world, is that those symptoms by themselves, so that's the key thing. If you have a slight runny nose by itself, then that in and of itself is not a reason for a child, and we're talking about children here, to necessarily stay home from school. So those are things that parents need to make that decision. There's some things that absolutely, if you have a fever, if you have a cough, those are things where they're much more likely to be associated with something that may be transmissible to others, COVID and other things. But other symptoms by themselves are not necessarily associated with that. So that's where we have a bit of leeway, and we've modified that. And there's also advice for if you have those single symptoms that you can keep the child home for 24 hours and monitor and see how things go. Because we know that children often have very mild symptoms that are a runny nose, not feeling well today, that clear up very quickly and are not indicative of COVID. So it's a balancing act to make sure that children are able to attend school as much as possible and minimizing the risk that they pose.
Shannon, do you have a follow-up?
I guess I would just say again, I feel like as a parent for months I've been hearing the same thing, especially from Minister Dix. and he used the term the slightest bit sick. And now we're being told, well, that doesn't really apply to children going to school. Isn't that confusing for parents? And what about teachers who are adults? Is it different for them?
Yeah, so it is different for adults, and absolutely. We have, as we've learned more about this virus, we need to find that balance to make sure that we are providing children with those opportunities that they need to be in the school setting. And as a parent, you'll recognize that, especially as we go into fall, there are so many things that cause children to have one symptom that have nothing to do with an infection. So it was trying to balance that, and it was learning from the evidence that we've had from other places where this has become an issue. And so we've put in a bit of a measure that allows parents and the students, if you're older, to make a judgment call around some of the minor symptoms that we know are not by themselves usually associated with COVID.
Next question is from Brenna Owen, Canadian Press.
Yeah, thank you. I'm just wondering, I was looking on some of the health authority websites where school exposures are listed, and I just wonder what exactly low risk means. You mentioned that the exposures so far at schools have been low risk. What does that mean in an indoor setting with a lot of people, students?
Yeah, so it means that somebody might have been there for a very short period of time outside wearing a mask. So those are each individual, and we've talked about this when we were talking about schools going back and the investigations that we do of every single case. So it may be that somebody didn't have any symptoms, didn't have any close contact with individuals. So even if it was indoors, they were at least a meter away, they were wearing a mask. There's an assessment that's done on every single case and every single situation. I will say that most of the school exposures are adults who are in the school setting, and we need to remember that as well. And in the first week going back, where teachers spent time together, we had some exposures there. We've also had some exposures where somebody may not have been in a classroom setting for a period of time, or in a place where it was a risky exposure, but then spent time outside of school with a small number of other students where those students may have had to stay home. So there's a variety of situations. This is what we expected, and this is why we are working so closely with schools to make sure that we can identify people quickly, minimize the periods of time that people are at risk, and that we have all those layers of protection in place.
Brenna, do you have a follow-up?
Yeah, just really quickly, also about schools, the definitions of like an exposure versus a cluster versus an outbreak. The definition of a cluster in schools kind of sounds similar to the definition of what is then an outbreak in the healthcare setting. And is that just because it's a healthcare setting where, you know, people are either a long-term care resident or they're an inpatient?
Yeah, we do taper it to the risk of the people as well as the risk setting itself and the things that people are doing. So a single case in a long-term care home, we manage as an outbreak, and that means we take additional steps to reduce the number of people there, to make sure that people can be separated. But unlike a school, we can't send residents in a care home somewhere else if they've been exposed. So in a school, it's a different environment, and an outbreak is when we start to see transmission between people who are perhaps in different classrooms or in different groups, where we need to take additional measures to ensure that transmission is stopped. And so it's, probable that we at some point may see an outbreak in our schools. But right now, not surprisingly, we've seen some people who have been in the school environment for short periods of time and who've then been identified as having symptoms or being a case, and we'll manage those as well.
Next question is from Catherine Garrett, My PG Now.
Hi, thank you so much for taking my question. I would just be interested in knowing the circumstances around the second death in Northern Health.
Yeah, unfortunately, this was a person who was in hospital, had been in hospital for some time, and they passed away this past weekend. I don't have the additional details at this point that I can share with you.
Catherine, do you have a follow-up?
Yes, please. I'm just interested in your thoughts on how the election will impact people in rural and remote areas heading to the polls, especially when you take into account voting by mail and advanced polling.
Yeah, so we'll be doing some detailed, provide you some details about that tomorrow. But Elections BC has taken a number of measures to make sure that it can be done safely in all of those environments. So First Nations communities and rural and remote communities, as well as some people who are in hospital or people who are in long-term care homes, that we can do it safely. And as you say, a lot of it will involve opportunities over longer periods of time, but also mail-in ballots. And we've understood from elections that have happened in New Brunswick and in other parts of the world during this pandemic that mail-in is an option that a lot more people will opt for.
Les Lane, Times Colonist.
Oh, thanks. Doctor, I may have missed something in your outline of how things are going to work for the next few weeks, but where's Minister Dix? He was booked to be at this, and then he canceled out. Is he not taking part in these for the duration of the campaign?
That's correct. Yeah, it would not be appropriate for him to be on the campaign and have the opportunity to speak publicly twice a week, but he will very much be involved in ensuring the ongoing management of the crises, along with Minister James, who's the caretaker minister during this period.
Les, do you have a follow-up?
I was wondering also about the, you've got a bunch of health inspectors and a lot of deputized inspectors or bylaw people in some fashion. And will you be monitoring all the work that goes into elections by political parties? Will you be monitoring to see that the guidelines that you've issued are enforced? And do those guidelines, are they enforceable? I'm just wondering if you'll be watching and citing infractions if people get carried away and start congregating or breaking the guidelines.
Yeah, so these are like we have with every other sector. It's the sector themselves that develop the guidelines. They're not my guidelines. I've given parameters around things they need to consider and advice around them. So each political party has come up with their COVID safety plan, as we've required, and Elections BC has a COVID safety plan, and we've been working with them on those. So they're not orders from me, so in that sense they're not enforceable. We absolutely will be monitoring and providing guidance and advice as needed to ensure that these are done in a way that is safe and doesn't put anybody, whether it's the candidate, their staff, people who are on the campaign trail, or the public at risk.
Next question is from Zara Premji, CBC.
Dr. Bonnie Henry. So there seems to be a discrepancy with how the different regional health authorities are posting their COVID-19 exposures within schools. All the authorities, with the exception of Vancouver Coastal Health, are posting each exposure event online. So when asked, Vancouver Coastal Health said it would only post it if it is unable to notify everyone involved directly. So why isn't there just one province-wide approach to publishing notifications in school?
There is one province-wide approach, and I think there was some perhaps misunderstanding when we first were posting these up, but we expect that Vancouver Coastal would adhere to what everybody else is doing, as well as our provincial standard.
Do you have a follow-up, Zara?
Yes, I do. Thank you. So also, Dr. Henry, the province of Quebec has officially declared it's in its second wave. Can we say that BC is entering that phase as well? And if we are, can we expect additional fines and enforcement measures to be added as cases continue to climb?
Yeah, it's a good question. I saw that from Quebec today, and I'm not clear exactly what parameters they're using. I know I've had discussions with my colleague and my counterpart in Quebec, and they've come out with their color-coded system, as you see. We've been looking at it slightly differently here from the very beginning. Each of us is dealing with our own pandemic, as we've said many times. And the key things that we are looking at here are around unlinked cases, and that's one thing where we have quite a difference between Ontario and Quebec, where the vast majority, we're still in the 80% of our cases we have linked to a known other case or a contact or a cluster or an outbreak. So those are things that I've been watching very carefully. We've also, as you know, started seeing our rise, and it's been not an exponential rise, but a bit of a linear rise and a flattening over the last little while. And the things that I look at, and with my colleagues here in BC, are, are we able to follow up on cases within an appropriate period of time, usually within a day or two? Are we able to find all of the contacts? Do we have the resources to ensure and support people to self-isolate? Can we connect cases with where they are? We're also looking at hospitalizations and ICU need, and we have a very detailed plan for that, which we presented a couple of weeks ago. So those are all the things that myself and the Deputy Minister and my colleagues in the health authorities look at regularly. So, and I think I called it a mogul before, but maybe a smaller wave. We definitely are seeing a resurgence. And the important thing is, can we manage this? Can we keep it under control without having that rapidly growing exponential growth? And so far we've been able to do that, but we all need to continue doing our part to keep it that way.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thanks for taking my question. You've kind of touched on this a bit, but now that we've had at least 26 exposures recorded in schools after only 1 week of classes resuming, I've been hearing from parents and teachers that are saying they're terrified that those clusters will explode into full-on outbreaks. And if that happens, what assurances can you offer that any outbreaks can be quickly contained?
Yeah, so I think the reflection that we're seeing is that we're on top of these and we're working with them. When somebody's identified, they're removed from the school. The people who've been in close contact are isolated, and we're supporting them to do that. So that's how we actively manage any case in the school, and that is what is going to help us prevent more transmission. And if an outbreak is identified, we'll manage that as well. We know how to do that now. We've seen it, we've done it in workplaces, we've done it in healthcare settings. Obviously we want to take all of the measures that we can to prevent the introduction into the school setting so that we can prevent those transmission events. And so far, I think we've been doing a good job at that, and that's reflected in the fact that we're picking up very quickly anybody who has symptoms, who turns out to have COVID in the school system. So I think we can be reassured by what we're seeing, and we are prepared, and we will continue to work closely with every single school to make sure that we're ready.
Marcella, do you have a follow-up?
Yes, just regarding Vancouver Coastal Health, this seems to be the second time during the pandemic where they have either miscommunicated or misunderstood what your directives are from Victoria. Earlier in the year, we heard that they were no longer having greeters at entrances to hospitals, and Health Minister Adrian Dix had insisted that they need to. So is there some kind of disconnect with Vancouver Coastal Health when it comes to reporting possible exposures at schools and other information that every other health authority seems to be providing more transparently?
I wouldn't say that. We talk regularly. I think there was, there's always different ways of doing things, and sometimes we think we're doing the same thing, and when it turns out it's something that's slightly off, slightly different. Each health authority has a different structure and a different way of decision making, so sometimes that can lead to confusion occasionally.
Next question is from Graham Wood, Glacier Media.
Well, hi, Bongi. Dr. Henry, if a child tests positive for COVID and attended school, can you confirm that all classmates will not be required to be tested immediately? And can you kind of describe or explain that process?
Yeah, so anytime a child or a teacher or a staff person or a bus driver tests positive or is positive, those people who have had contact where transmission could possibly have occurred are identified by public health. So most people are not in that situation. Even if you're in a classroom with somebody who has COVID, if you're sitting at a desk and you're not close to them, you've not had close contact with them. So this investigation is how we do for every single case. So we look at who had contact with who and what they did during the day and how it was, what types of measures they had in place. Was it inside? Was it outside? Did you wear a mask, etc.? So each of those is done on an individual basis. And unless we start to see transmission within a classroom, it would be very unlikely that an entire classroom would have to self-isolate. We have had situations where adults in a school have had contact with each other in a room together, having lunch, things like that. And sometimes that we've seen that in other countries as well, where those can lead to exposure events, and that all of those people would have to self-isolate and monitor. So this is how we manage outbreaks in every setting, and we'll be doing it as well the same way in schools. So not necessarily need to be tested unless people have symptoms, and otherwise they need to self-isolate. As we know, the test is only detects when you're shedding virus. So if somebody is in the incubation period and they don't have any symptoms and they're not yet sick, even having a negative test doesn't mean that you can go back to school. It means if you've been exposed, you need to wait that full incubation period before it's safe.
Graham, do you have a follow-up?
Sure. You mentioned there's a few thousand people on watch for isolation or potential contact. Do these people get tested, or are they kind of in limbo? Are their lives in limbo for 2 weeks, or is there any point at which they can get tested even if they don't have a symptom?
So yes, their lives are in limbo, and this is what we're trying to say. This is why it is so important for us to be aware of large events where we can have this type of exposure where many people might be involved, or we pass this virus on to the people we are closest to, the people we spend time with in a face-to-face environment. We know that it's mostly spread when we're close to somebody and we're talking or laughing or singing. So those are the situations we need to be more careful about. And when somebody's been exposed, there's nothing we can do to stop them from getting infected if they've inhaled enough dose of the virus. We just need to wait that period of time, which is up to 14 days, to see if they get sick with it. Most people get sick around day 5 to day 7. So even if they have very mild symptoms, they will need to be tested within that period of time. If they make it to 14 days without having any symptoms at all, then there's no need to be tested. And the situations, though, can be, it's not black and white as with everything. So if it's a cluster in a long-term care home, for example, we know that elderly people can get it very quickly, that we may have transmission that we haven't recognized. So we generally will test everybody at the beginning and then wait out the period of time. So there is some nuance if public health deems it important as part of their investigation to understand. And those are mostly higher risk settings where people are living together. So in a household or a communal living setting like a long-term care home, or we saw this with our temporary foreign workers where we had an outbreak and it was important to assess everybody, people in the correctional facilities. So there are situations where people will get tested, but having a negative test in the incubation period doesn't mean you're home free. It means you still need to wait that incubation period to make sure that you're not still developing a virus that's going to be able to infect others.
Andrea Wu, Global Mail.
Hi, Dr. Henry. With the majority of new cases being in younger people, I was hoping you could speak to the severity of disease that we're seeing in those under 40-ish now, and how that might be different from some of the earlier cases we were seeing. So, for example, do we have any young people in hospital right now, or are their symptoms generally quite mild? Do they even need to see a doctor?
Yeah, most younger people have milder symptoms, but not everybody. We've had now 4 people in their 40s who've died. So it does affect some people more than others, and the more people who get sick, the more chances are that we're going to have even young people with more severe illness. I don't actually have the age breakdown of people in hospital at the moment, but our average age remains quite high. It's in the 60s, and then people in ICU tend to be in their 70s, and we know the average age of people who've died is 70 to 80. So yes, it is much more likely to cause severe illness as we get older, but it can cause illness, and we're now learning more that it may cause lingering effects that can last for months, and we've only known this virus for months, so we don't know if those will recover over time, including for some people it can cause inflammation of the blood vessels in the heart, and that can last for a period of time. That is something we've seen with other viral illnesses as well. So we don't know yet the long-term impacts on young people, even if they have relatively mild illness. We do know that even young, healthy people can have pneumonia, can have profound fatigue that can last for quite a long time and lead them to not be able to resume their activities of daily living for many weeks to months.
Andrea, do you have a follow-up?
I do not. Thank you so much.
Thank you. And we have time for one more question this afternoon. For everyone listening, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question comes from Jane Side, North Shore News.
Hi, Dr. Henry. My question is also about the school exposures and the public listings for that. Again, it's about BCH that has not been listing all of the school exposures that have occurred. I've been hearing that some teachers and students who are in the same cohort and in the same classroom as people who have tested positive have not been getting notified by BCH, have not been being told to self-isolate, and they're concerned about the lack of transparency that's going on there. Can you comment about that?
Sure, and I will say that if there has been any exposure events in the schools, I absolutely am sure that my colleagues in BCH are following up with the individuals who are exposed. We do know that there have been people who have tested positive, but they've not been in the school setting during their infectious period. So often that engenders quite a lot of rumors, and people aren't sure about who's been where. So I can confirm that anybody who had close contact with somebody, whether it was in a school setting or outside of a school setting, will be notified by Vancouver Coastal Health. And yes, we have had people who have been infected either through family or through social contacts outside of the school system, but have not been in school when they were infectious. So we don't consider those a school exposure.
Jane, do you have a follow-up?
No, I don't.
Great, thank you. That's all.
Which I forgot to mention, that we usually do on Mondays, the PPE report, and that will be in a paper report as an addendum to our statement today. And on Thursday, we'll do the update on the surgery restart, and that will again be a paper report as part of our statement that we'll release today. Thank you.
Thank you.